Good evening, everyone. I would like to welcome all those who are listening from all across the country and thank you for joining us this evening for Sharsheret's national webinar on navigating insurance hot topics during cancer. My name is Bonnie Beckoff and I'm the Senior Support Program Coordinator at Sharsheret. Throughout the webinar, feel free to ask any questions by typing in the question box on your dashboard on the right-hand side of the screen. Please keep your questions broad in nature so that everyone on the call can benefit from the discussion. We will try to get to as many questions as we can after the presentation. Those of you who are not joining us via computer, please know that you can call Sharsheret at any time with your questions and we will be happy to discuss them with you. I would like to begin by thanking our sponsors who without their generous support for tonight's program would not be possible. Thank you Daiichi Sankyo, Amgen, Macrogenics, the Sigmund and Edith Blumenthal Memorial Fund, and our partners at Triage Cancer. For those of you who are not familiar with Sharsheret, Sharsheret is the Hebrew name for chain, and we are a national non-for-profit organization supporting young women and their families of all Jewish backgrounds who are facing breast and ovarian cancer at every stage. Our mission is to improve the lives of Jewish women and families living with or at increased genetic risk for breast or ovarian cancer through personalized support and saves lives through educational outreach. While our expertise is in young Jewish families as related to breast cancer and ovarian cancer, Sharsheret's program serves all women and men. Our goal is to connect to our community, whatever your personal background, stage of life, genetic risk, diagnosis, or treatment. As women are coping with illness, they are increasingly concerned about insurance coverage, financial planning, and general issues of financial and legal wellness. As with all Sharsheret's programs, we begin with our callers. Every day, we're hearing about your financial concerns, and we are determined to respond to your needs. Recently, we launched a new program called Best Face Forward 2.0, which provides services and subsidies for eligible individuals for non-medical services that are critical to a woman's quality of life and body image, and they are only partly covered by insurance companies, if at all. Best Face Forward 2.0 services include financial subsidies for wigs, cranial hair prosthesis, cold caps, scalp cooling treatment, and tattooing, three-dimensional micropigmentation of the nipple and areola. Additionally, there are complementary and holistic offerings such as meditation and yoga. For more information, please reach out to our clinicians at 866-474-2774, who will be happy to answer all your questions. As we all know, surgery and treatments can be very expensive, and insurance options greatly affect the impact of the financial strain. Just last week, a study from the Dr. Susan Love Research Foundation and the Sisters Network was published about the influences of treatment costs on breast cancer surgery preferences. The study showed that 43% of women considered costs when making a decision about treatment and breast cancer surgery. And 23% of the women reported that the cost of the treatment heavily determined what type of surgery they were going to have. 29% of lower income families did not have necessary medical testing. Additionally, according to the survey, even women with a higher financial income reported that cost was extremely important to them, and women in all financial brackets reported that breast cancer treatments depleted their savings. At the same time, research suggests the financial toll of a diagnosis may impact your health. A 2016 study conducted at the Fred Hutchinson Cancer Research Center in Seattle found that the financial toxicity resulting from the high cost of cancer is almost as deadly as cancer itself. This study speaks about the possible need for time off from work that can cause a loss of wages or loss of insurance, which can in turn cause one to have high out-of-pocket expenses. These financial and insurance concerns can increase one's stress level and cause the healing process to take longer. To help our community address these concerns, tonight's discussion, led by insurance expert, lawyer, and patient advocate Monica Bryant from Triage Cancer, will discuss important topics such as navigating your insurance, clinical trials, new research, and new treatments, and how they interface with insurance, how to pick a plan, understanding your EOB, step therapy, and access barriers, which will shed light on the financial difficulties caused by cancer and how to help mitigate some of it by properly knowing and understanding your insurance and choices. We will also hear a personal story from a woman who had to learn the hard way on how to navigate insurance and what the experience has taught her. After the presentations, we will have an opportunity for you to ask your questions. Our goal this evening is to establish an informative dialogue between our experts and those of you who may have questions about your insurance throughout your cancer experience. So with that, I would like to introduce Monica Bryant. Monica is a cancer rights attorney, speaker, and author dedicated to improving access to and availability of quality information on healthcare-related issues. Monica is the co-founder and chief operating officer for Triage Cancer, a national nonprofit organization that provides education on the practical and legal issues that may impact individuals diagnosed with cancer and their caregivers. Monica has spent many years working on behalf of individuals with cancer and has presented hundreds of educational seminars throughout the country for patients, survivors, caregivers, healthcare professionals, advocates, lawyers, employers, and the general public. We are privileged to have her here with us this evening. Monica, I will go ahead and work the slides for you. If you just tell me when to move on to the next slide, I will do so.
Fantastic. Thanks so much for having me here tonight to talk a little bit about insurance and navigating the process of dealing with insurance and clinical trials. Next slide. Given that we have a limited amount of time today, I just want to tell you a little bit about Triage Cancer and the services that we provide, so that after today's webinar, you have somewhere to go for more resources. So as was mentioned, Triage Cancer is a national nonprofit organization that provides education on the practical and legal issues that may impact individuals who are diagnosed with cancer and their caregivers. And we provide this education in several different ways. We participate in events all over the country, and at the end of this year, we will have been in all 50 states. Next slide, please. And one of the main events I wanted to mention are Triage Cancer conferences. And these are an opportunity for people to come together, so individuals diagnosed, survivors, caregivers, their healthcare professionals, lawyers, and learn about the most common topics that can impact somebody's finances, including health insurance. Next slide, please. We also host monthly webinars that are open to anybody in the community on a variety of legal and practical issues. The next one is actually this week on hospice care, and we also record our past webinars. So there's a couple of times throughout today's presentation I may point you back to a past webinar where you can go and listen to this entire topic again in detail. Next slide, please. In addition to our events, we offer a number of educational materials and resources online, and we refer to these as our quick guides. They're downloadable for free, and you'll see links in today's presentations, but we know that it can be hard to digest all of this information all at once, and so these quick guides are a snapshot of a particular topic, and we also have checklists and other documents to really help with the legal and practical pieces of cancer survivorship. Next slide, please. Now, the reality is where you live can impact what protections you have access to. So we have charts of state laws on employment, disability, health insurance, and other cancer-related issues. Today, I'm going to talk about some federal protections, but keep in mind that the state laws may actually provide you with additional or better protections, so critical to look there as well. Next slide. Now, we know that people learn in different ways, so we also have animated videos on cancer survivorship topics, and there's one specifically about health insurance basics and how to pick a plan. So again, after today, if you're thinking, wow, I really wish I could hear that again, please feel free to check out our animated videos. Next slide. And then throughout the many, many years of doing this, people would often say, I wish as I was making these decisions that I could just have you in my pocket, or I could just sit down and talk to you. And while I'm happy to do that to the extent that I can, you know, there's only a couple of us. And so what we did instead was create cancerfinances.org. And this website provides practical information on the topics that can impact your finances. It's designed to guide users to the information that's most relevant to their situation. So it's sort of a choose your own adventure type website. So with that as background, as additional places in addition to Sharsheret, where you can go to get some information, I want to get to the heart of the topic today, which is health insurance. Next slide, please. Now, the reality is that health insurance is confusing. But to get the most out of your plan, there are some basics that are really useful to know. There's 3 main places where we get health insurance in this country. The fewest number of Americans get their insurance directly from a health insurance company. The next largest group get their insurance through the government, primarily through Medicare or Medicaid and the military. And then the largest group of Americans get their insurance from an employer. But many of us, regardless of where we get our insurance, don't understand even the terms that are being used. We often joke that there should be a class in high school that teaches us about health insurance because we all need to use it, but yet none of us are really taught how to. So starting at the top, there are some costs that you will incur just to have health insurance coverage, and that's called your premium. It's what you pay each month just to have coverage. So you're going to pay them even if you never go to the doctor. Then there are going to be some additional costs that you pay when you actually get medical care, and these are going to differ depending on your policy. So first is your annual deductible. This is the amount that you have to pay out of pocket each year before your health insurance policy kicks in. This fixed dollar amount could be anywhere from $0 to $7,000, all depending on the plan. Next is your copayment. This is also a fixed dollar amount, and it's a payment that you pay when you get certain types of care. For example, many policies have a copayment of $20 when you see the doctor, or a $250 copayment if you go to the emergency room. And then all plans are also going to have a coinsurance or a cost share. And these are 2 terms that mean exactly the same thing. And it's the difference in what the insurance company pays for your medical care and what you pay. So you're literally sharing the cost. For example, if you have an 80-20 plan, then the insurance company is going to pay 80% of your medical expenses, and you're responsible for 20% of your medical expenses once you've met the deductible. And finally, there's your out-of-pocket maximum. And this may be one of the most important things to understand about your health coverage. Again, this is going to be a fixed dollar amount that's going to depend on your policy, but the way you get to your out-of-pocket maximum is by paying your deductible, plus any co-payments that you make during the year, plus any co-insurance that you make. So it's everything that you pay except your monthly premiums. Now, once you reach that out-of-pocket maximum, your insurance pays 100% of your medical expenses, and you don't pay anything for the rest of the year except your premiums. So by understanding how your out-of-pocket maximum works, you can plan around what your costs might be in the worst case scenario and hopefully avoid financial ruin after a serious medical situation. So when you're thinking about these out-of-pocket maximums, remember that insurance companies usually are only going to count expenses that are from in-network providers. Could you please advance to slide 11? So to give you an example of how this out-of-pocket maximum works, one more slide, please. I'd like you to meet David. David was in a car accident, next slide, please, and spent a week in the hospital that is in his policy's network. He ends up with a $102,000 hospital bill. So how much does he actually have to pay? David's plan has a $2,000 deductible, an 80-20 coinsurance, and a $4,000 out-of-pocket maximum. Next slide, please. So how much does he end up having to pay of that total $102,000 hospital bill? Next. First, he has to pay his deductible of $2,000, which leaves $100,000 of that bill left. Next. Then he has a 20% coinsurance. Well, 20% of $100,000 is $20,000. But does he have to pay that whole $20,000? Next. No, he doesn't. His out-of-pocket maximum is $4,000. So since he's already paid $2,000 of his deductible, he only has to pay another $2,000 to reach his $4,000 out-of-pocket maximum. So I'm not suggesting that $4,000 isn't a lot of money. But when we compare it with the $20,000 he'd have to pay just of his coinsurance, or the $102,000 he would have to pay without insurance, it certainly becomes more reasonable. So again, understanding your out-of-pocket maximum is critical for picking a plan, which we'll get to in just a few more slides. Next slide, please. So I want to talk a little bit about prescription drugs. So insurance plans that cover prescription drugs, as most do, next slide please, generally have a list of drugs that they will cover, and they will tell you at what rate they're going to cover those drugs. And that list is referred to as a formulary. Formularies are typically going to group their drugs into tiers, and the tier that your medication is in is going to determine how much you're going to pay for that. So typically, formularies are going to have somewhere between 1 to 5 tiers. The higher up you go in tiers, generally the more that you have to pay. Now, many insurance companies also employ something called step therapy. Step therapy means that you're required to try less expensive drug options at lower tiers before stepping up to drugs that might cost more. So in many instances, this might mean that you're required to try a generic drug before you try a brand name drug. Now, in some circumstances, it can be really concerning to people that they aren't able to access the exact drug that their provider prescribes. But the good news is there are some workarounds or options if you're in this situation. If you've already tried the more affordable drug and it didn't work, or if your healthcare provider believes that it's medically necessary for you to be on a more expensive drug, your provider can contact your health insurance company and request an exception. So an exception request is a type of appeal that your healthcare team submits on your behalf. And most insurance companies have their own forms that need to be submitted. And along with that specific form, your healthcare team is going to need to provide some documentation that step 1 medications have already been tried, or they're likely to cause adverse effects. So in this exception request or appeal situation, it's absolutely a time when you have to be having conversations with your healthcare team about your concerns and enlisting their help. Next slide, please. It may also be that you experience another type of claim denial from your insurance company. And the good news is that you don't have to take no for an answer. Generally, you have 2 chances to appeal a denial of coverage. There's an internal appeals process and an external appeal. Internal appeal is going to be through your health insurance company. And thanks to the Affordable Care Act or Obamacare or state law, every state is required to have an external process. And this is incredibly important because we know that somewhere around 60% of all appeals are decided in favor of the patient. So it's absolutely in your best interest to appeal denials. And we actually have a quick guide on appeals that was released earlier this month. Next slide, please. Now, as many of you may know, the Affordable Care Act also made some changes to the way that insurance is handled in this country. And perhaps most significantly, it changed the way that insurance companies can treat people with pre-existing conditions. Next. First, it said that insurance companies can only look at 4 things when they're deciding how much they're going to charge someone. Are they buying an individual or a family plan? Their geographic location, their age, and their tobacco use. So this takes out pre-existing conditions and gender out of the equation. Next slide, please. The second thing that the ACA did was it said that insurance companies cannot deny selling somebody a policy or refuse to cover care related to a pre-existing condition. So this is incredibly game-changing for our community because the bottom line is that this means you cannot be denied coverage or charged more just because you've gotten sick. This gives us some more options. Next slide, please. One more, please. Now, the time that you have to enroll or make changes to your coverage is going to depend on what type of coverage that you have. So Medicaid applications are accepted year-round, so as soon as you're eligible, you can apply. For plans purchased from the individual insurance companies, generally you can enroll and make changes during open enrollment. Now, open enrollment for this year is closed, but for 2020, it will start November 1st and go through December 15th. This is a condensed open enrollment period from previous years. So in states that run their own marketplaces, like California, for example, open enrollment might last longer. So it's important to check your state's rules. Now, Medicare open enrollment is also coming up, and employer plans may vary, but generally they all happen in the fall. So this is a prime time for us to be having this conversation about how to choose a plan. Next slide, please. The good news, though, is that the ACA recognized that changes don't just happen during open enrollment, so they created a special enrollment period where if you have a life-changing event that's going to result in you losing coverage, you have 60 days to shop for a new plan in the marketplace. Next slide, please. Now I'm going to go through a quick example of how you can go about comparing your plan options. Go ahead and click through 4 times, please. Now this is going to apply whether you're looking for a marketplace plan, whether you're comparing 2 employer plans, whether you're trying to decide, do I keep my employer plan or do I take a marketplace plan, or even if you're comparing 2 Medicare plans. Next slide, please. So here I've provided you 3 different examples of policies. First is a bronze, the second is a silver, and the bottom one is a platinum, and you can see they all have different expenses. But can you tell just by looking at them which is going to be the most affordable at the end of the year, assuming you're going to hit that out-of-pocket maximum? And when we're talking about cancer care, the reality is you're probably going to hit that out-of-pocket maximum. Well, I certainly can't tell just by looking at it. Please click a couple times, 3 times, 1 more. The way you understand which is going to be the most affordable is by doing the math. And here's how you do the math. You take the monthly premium and you multiply it by 12. That's how much it's going to cost you for the year. And then you add the out-of-pocket maximum. When you do this for all 3 plans, you can see that that bottom platinum plan that costs $400 a month ends up being close to $2,000 cheaper by the end of the year. It's also important to note that that bottom plan has a $0 deductible, which means that plan starts picking up 90% of your healthcare costs right away. Whereas that top bronze plan that appears to be cheaper monthly has a $6,000 deductible. That means you have to write a $6,000 check before the insurance company starts paying a penny. So with this knowledge, we can start making some educated decisions and understanding that we can't get sticker shock just looking at that monthly premium, that we have to look at the big picture. Next slide, please. But of course, cost is only part of it. You have to check the networks of doctors and hospitals to make sure that your doctors are covered. You also need to check the prescription drug coverage. So what drugs are covered? Is there a separate deductible? Does it require step therapy for a particular drug that you're taking? All of this information is incredibly important to look at. Next slide. Now, thanks to the ACA and its new protections, we are in a world where we get to review our options every single year, and we get to make changes based on where we are right now. So if somebody's in the midst of active treatment, they may be making different decisions based on the knowledge that they're likely going to hit that out-of-pocket maximum, compared with someone who's maybe out of active treatment and isn't accessing as much medical care now as they used to. Next slide, please. Now, a brief nod to clinical trials. Clinical trials are incredibly important, and they're the main way that we find new and better treatments for coverage. But we have to know what it's going to cost us. And part of that includes what your insurance company is going to pay for and what out-of-pocket costs you might have. Now, if you have private insurance through your employer, the marketplace, or a plan that you bought on your own, the ACA requires your insurance company to cover any routine costs associated with participating in that trial. So routine costs are ones that you're going to pay if you were getting standard treatment, including visiting the doctor's office, getting scans, any medications to help with side effects. So it's typically everything except the treatment being tested, and that's usually paid for by the clinical trial. Now, when it comes to Medicaid, it's up to the state, so you should definitely check with your healthcare team if you're receiving Medicaid. Next slide, please. Now, Medicare and military plans also will cover the routine costs, but they all have a little bit of different details. So if you have one of these types of insurance, again, very important to talk with your healthcare team so that you understand the costs. Next slide, please. Now, certainly there are some eligibility requirements about participating in clinical trials, but if you're not eligible, you may be able to get a special exception or apply through the FDA Expanded Access Program to access clinical trials. Next slide, please. But insurance isn't going to cover all of your costs, even if you have insurance through a marketplace. So it's important to talk with your team about other sort of practical costs that may arise. And we've listed some questions for you to ask here. And the reality is you might incur these costs whether you're in a clinical trial or not. We just want people to be aware of them so that they can make educated decisions. Next slide, please. And then just as a reminder, we recently released an animated video on clinical trials funded by the Metastatic Breast Cancer Alliance, where you can hear all of this and more, and it points to some additional places to go for resources. Next slide, please. So once you get treatment, regardless of where you get your treatment, you're going to get a couple pieces of information. From the insurance company, you could get 3 different pieces of mail, but the most important is going to be the explanation of benefits. Next slide. Now you can generally tell that this is the explanation of benefits. It looks like this slide's a little formatted funky, but you'll see in big bold letters somewhere words saying this is not a bill. Next. You're also going to see some information about the member, who the patient was, the information about the summary. Next, please. Click through 3 times. And then you're also going to get some information about the services. It is incredibly important to check to make sure that this all looks correct. Now, some EOBs won't have any words on them. They'll just have a CPT code. So you may need to contact your healthcare provider to get some more information about what you're being billed for. Next. Now, at the bottom here, you'll see that on EOBs, a good EOB will also have some information about how much you've paid towards your deductible and your out-of-pocket maximums. This is also very important to keep track of so that you know how close you are to that out-of-pocket maximum. Next slide, please. Now, the last thing that you're going to get is a communication from your provider, and that's going to be the bill. The problem is it doesn't always happen in this order. Many providers are faster at sending the bill than the insurance companies are at processing the claim. So if you pay that bill before you get your EOB, you may be in a situation where you're trying to get money back from your provider. So our general rule of thumb is to wait until you've received your EOB before paying any bills. Now, it's important to communicate with your providers and let them know, hey, I haven't gotten my EOB yet, that's why I'm not paying. And most of them will just push back the due date or put a note in your file. Next slide, please. I mentioned reviewing your bills for accuracy, and that is incredibly important. We hear stories all the time about mistakes in billing where people have been billed for 11 surgeries instead of 1 because someone accidentally put the 1 in twice. If you have extensive bills and you think there are mistakes or you were misbilled, there are professional bill reviewer services that you can enlist. These are just some examples. We're not endorsing any of these, but it could be a good option for some people. Next slide, please. So today we have just provided an introduction to these topics, and I just want to remind you that Triage Cancer has resources designed to help navigate all of the practical and legal issues that can come up and impact your finances. And if you go to our resources tab and do resources by topic, this is what you'll see, and it'll take you to some more information. Next slide, please. So I look forward to your questions later on, but if we don't get to them tonight, please know that we are happy to be available to you and a resource to you in the future. So with that, thank you, and I look forward to your questions.
Thank you, Monica, for all that wonderful information. The insurance world can feel a bit overwhelming and confusing and sometimes frustrating, and I believe you have armed us all with so much helpful information. Thank you so much. And now it is my pleasure to introduce our peer supporter, Sarah. Sarah has agreed to share her personal story about what she has learned on how to navigate the world of insurance.
Hi, everyone. I'm so glad that I could be here tonight and share a little bit about my story. I hope it will, give a little bit of insight of how hard, as many of us know, it could be. So just for a little bit of background, I guess, I come from a long family history of women who had breast cancer. So it was no surprise when I tested positive for the CHEK2 mutation, which is a mutation that increases my risk for breast cancer. After receiving my positive test result, my doctor sent me for a baseline breast MRI. The office where I scheduled the MRI did not accept my insurance, but was willing to work with me and submitted to my insurance on my behalf. Luckily, at the time, I had a low out-of-network deductible, and my insurance company paid for my MRI. As with 40% of all baseline MRIs, mine came back with an enhancement that led to a 3D monogram, an ultrasound, and an MRI guided biopsy. This entire time, my insurance plan covered basically majority and much of my costs. Luckily, the biopsy also came back negative, but as a standard of care, I was told to come back 6 months following for an MRI guided biopsy, and you need to return for a follow-up MRI also. 6 months later, though, when it was time to go through this all again, my insurance had changed because my husband had switched employers. While I have what's considered to be a good coverage, my out-of-network deductible is very high, and the time was completely unmet, meaning my doctor's office would receive no reimbursement from my insurance company, and I'd be responsible for $750, a reduced rate they were offering me. $750 for an MRI was way too much for me, so I decided to look elsewhere. Unfortunately, looking elsewhere essentially meant that I couldn't get around to finding a new location for an entire year. When I finally got my act together to find a new doctor's office, I looked for an office where I trusted the medical care above all, and that was in my network with my plan. Looking for doctors that are in network was something I had been trained to do since I was young, and the only question I thought I needed to ask. When I got a bill, though, for $1,300 for my MRI, I realized how big of a mistake I made. As soon as I got the bill, my first instinct was to call the insurance company, assuming the insurance just wasn't applied correctly. What I found out from my insurance company was that my bill, unfortunately, was correct. They explained that doing an MRI at an in-network facility associated with a hospital required me to first meet my deductible, which was $1,000, and then pay 20% of the co-insurance, which in this case would have cost an additional $300. Had I done the MRI at an in-network freestanding location unassociated with any hospital, it only would have cost me a $100 copay. Unfortunately, the $1,300 MRI required an additional follow-up MRI, but this time I was smarter and I knew that I needed to call my insurance first to request a list of all in-network freestanding radiology practices in my area. While I did only pay $100 for the next MRI, I learned another valuable lesson here as well. When you get an MRI at a freestanding practice, the radiologist reading the MRI was not a doctor that I had pre-selected. In fact, the radiologist reading my MRI was someone I never heard of and knew nothing about. And while I wanted to submit the MRI for a second opinion through the doctor's office that I knew and trusted and where my care was all being coordinated, because the MRI came back normal, my doctor's office refused to give a second opinion, which is per their protocol. So through my whole experience, what I really learned that could apply for anyone and what I feel like is important to share with everyone tonight is never assume that tests, treatment, and procedures associated with your cancer care, any care that you're watching simply needs to be in network to be covered. There really might be other requirements that you might not realize. It's also really important to understand your insurance plan so you make the right decisions, and you could pick up mistakes when you get the bill, and this happens all the time. Another thing I learned was never pay a bill before matching it to your EOB and calling your insurance company or the doctor's office with any questions about your bill. If the EOB doesn't seem to make sense to you, don't pay it. And this, I was really happy to hear that Monica had also brought up and mentioned. Also, call the facility where you're having your procedure and ask them for the procedure code, service code, any tax ID information, or general information about the facility. Then call your insurance company and find out what the cost will be beforehand. You can always ask your insurance company to send you a list of in-network providers. Sometimes it's helpful to share that list with your doctor so they can maybe point you in the right direction. And it's crazy that I'm even saying this because as I was sitting down to write this actually just happened to me where I had to schedule another MRI and I called up the place and I gave them my insurance and they said, yeah, we're covered. But then when I was talking to my insurance, they're like, no, we don't cover it. And there was a little bit of back and forth trying to figure out why. And then I realized that the facility where I was going that took my general insurance plan didn't take my specific care plan. So it didn't matter that I had the insurance that they took. So then I had to go back to the insurance company, ask them for the list, and sort of even learn from my mistakes, which sometimes I keep making. Another thing I really learned was sometimes there's a trade-off. While it may be less expensive, you might not get the care you want. You need to determine what makes the most sense for you. And this is something that I'm constantly struggling with, is figuring out how do I weigh my doctors and the people I feel comfortable with, reading my results and taking charge of my plan versus the cost of following up with my treatments. So I hope that hearing this might have been helpful, and thank you so much, Monica. If anyone has questions, I'll be happy to try to answer.
Thank you, Sarah. We will now begin our question and answer period. You can type your question in the text box located in the dashboard to the right of your screen. We already have a few questions that came in, so we will begin with those. The first question that we received is financial help available to pay for lymphedema compression, bandage systems, and garments and devices. Right now, our BFF 2.0 program, our Best Face Forward 2.0 program, offers subsidies for wigs, scalp cooling, and micropigmentation and tattooing. Monica, are there ways women can get help with these costs through insurance?
So it's going to depend totally on the coverage that you might have, because it's going to differ, unfortunately, but that's definitely a question that people should be calling and asking their plan about. And also there are a lot of healthcare providers know the local boutiques that are able to help bill for these types of services. So unfortunately, it's one of those it depends answers based on your coverage.
Thank you. Another question that came in, Monica, I think this maybe is something that you can help us with. Can you please clarify, is the copay a % of the list price or the amount the insurer actually pays the provider?
So it depends. If you are going to an in-network provider, which means that that provider has contracted with the insurance company to accept what's called the allowed amount or the contracted amount, then the copay is going to be a percentage of that amount. If you're going to an out-of-network provider and they do provide some out-of-network services, then it's going to just be a percentage of what that provider is billing.
Perfect, thank you. Is there a difference between an individual out-of-pocket expense and a family out-of-pocket expense?
Yes and no. So conceptually, they are exactly the same thing. But with the family out-of-pocket maximum, it's usually only going to benefit people that have more than 2 members of the family. Because generally what happens is those 2 people together, their individual out-of-pocket maximums are going to make the family out-of-pocket maximum. So then family members 3, 4, etc. are going to benefit from hitting the family out-of-pocket maximum.
Okay, another question we got was, how long should you keep an EOB for?
So generally speaking, it's going to be somewhere between 3 to 7 years. And the reason that you want to keep EOBs is for tax purposes, because depending on how much you've paid for your medical care, you may be able to deduct those on your income taxes. So generally what we suggest is that you talk with a tax preparer or an accountant about that, and then ask them in your area what's the best sort of time frame. But the kind of rule of thumb is somewhere between 3 to 7 years. I'm one of those people that errs on the 7 years.
Good to know. Perfect. And one more question that we have here is, sure, what happens if a plan is grandfathered in and is not required to participate in a clinical trial?
Fantastic question. So for the rest of you who don't know, a grandfathered plan is a plan that was in existence prior to March 23rd, 2010, which is when the Affordable Care Act was signed into law. And if it existed prior to that date and hasn't made substantial changes, it's considered grandfathered. And those grandfathered plans are exempt from some of the protections in the Affordable Care Act. And one of those protections is being required to cover the routine costs associated with clinical trials. And so that's just it. They're not required to comply with that. For all intents and purposes, the only grandfathered plans we're still seeing in effect are large group employer-sponsored plans. So if you have a grandfathered plan and you think you want to participate in a clinical trial, one way to deal with this is declining your employer coverage and purchasing a standalone plan in your state's health insurance marketplace. That's not always going to be financially feasible for everybody, but it is a possibility. Thanks to the Affordable Care Act, we're no longer in a situation where we have to take our employer's plans once we have a pre-existing condition. We have some more options now.
Thank you. So interesting. Thank you so much.
You're welcome.
The questions keep on pouring in, so I'm going to give you a couple of more if that's okay.
Absolutely.
What is the deal with Medicare not being able to offer incentives like financial aid?
So that is an interesting political conversation, but essentially it's about, it's not that Medicare isn't able to provide financial aid, because Medicare does have some financial assistance programs to help individuals with lower incomes pay for the out-of-pocket costs. What I think the question asker might be getting at is, why can't the pharmaceutical companies provide financial assistance to Medicare beneficiaries? And it has to do with looking like they're incentivizing Medicare providers prescribing their drugs. So that has just been a rule that has been in existence. And so for those individuals, we generally try to make sure they're able to get coverage in other ways. So that might be, if they have a Medicare Advantage plan during open enrollment, maybe now's the time to get to original Medicare or vice versa, or changing your Part D plan. And like I said, when you're making those plan choices, the same analysis that I went through with the marketplace plans works when you're trying to figure out, well, what are my Part D costs going to be? Or what are my Medicare Advantage plan costs going to be? That same analysis still works.
Got it.
And for anyone who's totally confused about what I just said about Medicare, which is fair, Medicare is super confusing. If you are on Medicare or about to be on Medicare, we have an hour-long webinar that goes through all of the different parts and how to make some choices and assessments of what might be the best for you, archived on the website.
Perfect. Here's another interesting question. What advice do you have for choosing a Medicare plan for people with metastatic cancer?
So the lawyer in me is going to start with, we don't provide advice. We just provide education so that you can be empowered to make your own choices. But I would say, honestly, it's the same for everybody. You need to be looking at, what is the plan going to cost you? What are your needs? So original Medicare, which is Medicare Part A and Part B, is fee-for-service Medicare, which means that you can go to any provider in the country that accepts Medicare. Whereas if you pick a Medicare Advantage plan, otherwise known as Part C, those are going to have smaller networks of providers. So I live in Chicago, and there's what we refer to as snowbirds. So, someone who gets part of their care in Chicago during the summer and maybe gets part of their care in Florida in the winter, an Advantage plan with that small network would be a terrible idea. For those people, probably original Medicare would be a better choice. So I think it just depends on everybody's own situations. And again, if you're making those choices, I would really recommend watching that webinar, because it kind of gives you start to finish the building blocks on how to make those decisions.
Great information. Another question that came in, What do I do if I don't have insurance, but I feel a lump?
That's a tricky one. Well, it again is going to depend on your situation. So in all states, there's a breast and cervical screening program. So that's definitely an option for you to go get screened. And in some states, not all states, there's also a treatment program associated with that. There's some income requirements associated, but that would be certainly one option. Now, even if you don't have insurance now, I wouldn't suggest delaying getting it checked out. You may have to pay for those initial appointments out of pocket. But remember, open enrollment is coming up. And so that's the time where you can purchase a new plan. And thanks to the Affordable Care Act, you cannot be denied based on a pre-existing condition. So it's not a perfect situation. We don't want people to be uninsured and be in that situation, but we certainly know that it happens. And again, the good news is thanks to the Affordable Care Act, we have some more options now than we did even 5 years ago.
Thank you. Can you speak more about the services that you mentioned where you pay them to help with claims and appeals?
Sure. So there are professional bill reviewing services out there. They all operate a little bit differently. Some will look through all of your claims and everything that you've paid and look to see if there's any mistakes, or maybe you shouldn't have paid as much, or a claim was denied. Some of them charge a flat fee up front. Some of them charge a flat fee plus a percentage of any money they get back for you. Some of them just charge a percentage of the money they get back for you. Now, I generally don't recommend these for people who maybe think there was only, one mistake, because when you start doing the cost benefit analysis, it may not work out. But for folks that have been through extensive treatment, many providers, and think that there are mistakes, it might be a worthy endeavor.
Excellent, excellent. I have one final question.
Sure.
How do I find out if my employer provided insurance requires me to have Medicare Part B?
So I'm assuming this is for an individual who is over the age of 65 but is still working. Many individuals in those situations will keep Part A, because assuming they've worked and paid into the system, Part A is going to be free, and decline Part B and just keep their employer-sponsored insurance. But occasionally, when somebody has what's referred to as retiree insurance from their employer, those plans will require individuals to have Medicare in addition to their retiree-only plan. And basically what ends up happening is, and I'm generalizing here, but Medicare usually pays first, and then the employer plan acts as what's called a supplemental plan and picks up those out-of-pocket costs. If you're unsure of what your employer is requiring, I absolutely suggest that you talk to whomever at your job handles employee benefits. That could be HR, it could just be a person, depending on your employment setting, to see what their rules are. You could also call the number on the back of your insurance card, but I generally recommend that people do both of those things and make sure that the answers match. Because the reality is, sometimes when you call, people don't always know exactly what you're getting at or have all of the information. So it's always good to do your due diligence to make sure that you're as protected as you can be.
Wow, thank you so much, Monica. Such valuable information. We really appreciate it. I think that's going to end. Oh, thank you. I think that's going to end our question and answer session for now. Your feedback is greatly important to us, and we are committed to staying relevant by enhancing our programs to reflect the growing and changing needs of the women and families of our Sharsheret community. With that in mind, you will be receiving an evaluation in your email box in the next couple of days. Please take a few minutes to complete the survey. I want to thank Monica and Sarah. We truly appreciate the information that you shared with us and that you shed light on such important information and the importance of perseverance. A video and transcript for tonight's presentation will be available on Sharsheret's website. You can access it by going to www.sharsheret.org/teleconference-webinars. It's on your screen right now. I would once again like to thank Daiichi, Cinco, Amgen, Macrogenics, the Sigmund and Edith Blumenthal Memorial Fund, and our partners Triage Cancer for sponsoring tonight's program and their continued support of Sharsheret. The conversation doesn't have to stop here. You can visit Sharsheret's website at www.sharsheret.org or call us at 866-474-2774 to discuss tonight's topic or any other concerns you are facing. Additionally, please don't hesitate to call us about our new financial subsidy program, Best Face Forward 2.0, to schedule an appointment to begin the application process for wigs, cold caps, and 3D tattooing of the nipple and areola, or to help with any insurance questions that you may have with. Thank you so much for joining us and have a great rest of your evening.